All right, so um, I'm just trying it over again. So hopefully this is okay now. Now, as I said earlier, as I told you, so again, the vertebral column, it is protected by not only so again, where do you find your spinal cord? The spinal cord is found within the vertebral column. And again, these are all the backbones. So again, if you remember, there's an opening, the vertebral canal, that all the backbones form. So in addition to that, protecting the spinal cord, there's also the meninges. And again, this is soft tissue. And these soft tissues consist of 3 layers. Dura mater, which is the outermost part. There's the arachnoid matter, which is the middle part. And then the innermost matter is the pia mater. So when you look over here, again, this is spinal tissue, spinal cord. So this would be completely surrounded by bone, of course, your vertebral column. And in addition to that, you have these 3 layers of tissue that you see. So here we go. This is the dura mater that you see all the way out over here, right? And then this would be the arachnoid matter. Okay, this is your middle layer. So between the dura mater and the arachnoid matter, you have a space in between, and we call that the subdural space. So sub means under. Dura, again, that's referring to the dura mater space. So again, they're saying there's a space between the dura and the arachnoid. Okay? So after the arachnoid, the next part that we have is this part over here, and this is the pia mater right over here. It's in, I guess it's a peach color or a light pink. So this is your pia mater. And then again, between the arachnoid matter and the pia mater, this space is called the subarachnoid space. It's subarachnoid, under the arachnoid. So again, 1, 2, you have 3 layers of additional covering to protect the spinal cord. Now, as you move along, you can see in this photograph here, what do we have? You have the spinal cord over here, and this part over here, that's your dura. This is the dura mater. So this topmost part, that's the dura mater, and then you have the arachnoid after there. This is going to be the subarachnoid space, this part. Okay, so between the dura and the arachnoid, it's, again, because it's tissue, it's very difficult to differentiate and discern that. So it's not being shown properly. So again, this is both, we're looking at dura and arachnoid. What you can see is the subarachnoid space, relatively clear. And then after that, what do we have? You have spinal cord, and then of course this part that goes around here, that's the this will be the directly on top of that we have the pia mater that's going to be here. So moving along, when the spinal cord is viewed externally, we see 2 very distinct enlargements. So the first one is the superior enlargement, and the superior enlargement, and then there's so again, the superior enlargement is also because it's found up above. You have the cervical enlargement, and the cervical enlargement, it goes from the 4th cervical vertebra to the 1st thoracic vertebra. Okay, so C4 to T1 is the where we have that. So our nerves, they tend the nerves too, and coming from your upper limbs, they end up being served by the cervical enlargement. So again, all of your upper limb function, that's responsible from the nerves that are going out and coming into the cervical enlargement. Now the inferior enlargement, which is called again, that's also referred to as the lumbar enlargement. It goes from the 9th to the 12th thoracic vertebra. Okay, so T9 all the way down to T12. Right? And this is the lumbar enlargement, which is also, again, part of again, when you talk about location-wise, this is going to be the inferior enlargement that you see. So for the lumbar enlargement, again, nerves that are going to and from your lower limbs, they come off of the lumbar enlargement. Now, inferior to the inferior to the lumbar enlargement, the spinal cord terminates as a tapering. Okay, and tapers into a conical structure, and this conical structure hence ends up being named the conus. Okay, conus medullaris. Now, the conus medullaris ends at the level of about, well, where you have the intervertebral discs between L1 and L2, of course, in adults. Now, arising from the conus medullaris, we end up having the filum terminale. The filum terminale, this is an extension of the pia mater that extends inferiorly, and it ends up fusing with the arachnoid mater and dura mater. And what this does is that it allows it to anchor the spinal cord to the coccyx. What else? So again, you can see these two enlargements. This is going to be your cervical enlargement, and then this is going to be your the inferior enlargement here, right? So you have your superior enlargement, inferior enlargement, superior enlargement. Again, this is the cervical enlargement, and then the inferior enlargement we call the lumbar enlargement. And so again, when you look at the here's that the filum terminale over here, and there's a structure. Let's see if it's over here. All right. Anyway, it's not seen over here. So again, you can see that for your upper limbs, essentially, for the upper limbs, again, you're looking at right from over here, C4 all the way to T1. This is the region where you find this enlargement. So all the nerves that are coming from your shoulder, your arm, your fingers, they all enter eventually to the spinal cord over here at this point, somewhere between here and there. Okay. Then for your lower limbs, when you go down, we're looking at right around there, T9, all the way down to this part here, T12. So for your legs and your toes, those nerves, they end up coming off of this region here, between T9 and T12. 1, 2, 3, 4 over here. All right. So you know, one of the things that that'll get done is a spinal tap. Now, the spinal tap, again, or it's also referred to as a lumbar puncture. A lumbar puncture. You know, a local anesthetic is given, and then they take a needle that they put into the subarachnoid space, and they're doing that to remove cerebral spinal fluid, or CSF, and they're able to do diagnostic tests with that. In addition to that, sometimes, you know, they may do that to put in antibiotics, or again to insert some chemicals that act as a contrast for specific types of X-rays. And again, sometimes they'll just do that to administer anesthetics. They may even do that for chemotherapy. Other times, again, they'll do that if they want to measure cerebrospinal, how much pressure there is within the CSF as well. They may end up doing this this lumbar puncture, okay, or spinal tap. So those of you that are nursing, my nurses, you guys may end up seeing this being used when you're in the field. That's all I'll say about that for now. Now, all right. So the anterior fissure, the anterior median fissure, is a wide groove that we find on the anterior, or again, the ventral side of the spinal cord. The posterior median sulcus is a narrow groove that we find on the dorsal side, or the posterior side of the spinal cord. Now, when you look at terms like, gray matter, we'll talk a little bit more about that. But the gray matter, it makes up primarily all the cell bodies of neurons, neuroglia, and the unmyelinated axons, in addition to dendrites of interneurons and motor neurons. Whereas the white matter, on the other hand, it's made up of bundles of myelinated axons of both sensory as well as motor neurons, as well as interneurons, right? So white matter, myelinated axons of both motor, sensory, as well as interneurons. So when you look at this gray commissure, the gray commissure, it forms the crossbar of the H that we see. Or again, when you kind of look at a cross section of the spinal cord, it looks like a butterfly. So that H part, again, that crossbar that you see, that's called the gray commissure. Now, in the center of that gray commissure, we have a small space, and that space is called the central canal. The central canal, it extends the entire length of your spinal cord, and this is where we find cerebrospinal fluid. Now, at the superior end, the central canal, it's continuous with the fourth ventricle, and this fourth ventricle, this is a space that also contains CSF. Now, anterior to the gray commissure, so in front of, we're saying, or ventral, we have the ventral white commissure, the anterior or ventral white commissure. And this connects the white matters of the right and left sides of the spinal cord. All right, so the white matter, just like the gray matter, ends up being organized into regions. The anterior and the posterior gray horns, they divide the white matter on each side into three areas that are called columns. And so these three columns, they are this anterior or the ventral, they call it anterior or ventral, the white column. Then there's a dorsal, or again, you can say dorsal white column or posterior white column. And then of course there's just the lateral white columns. Now each column contains very distinct bundles of axons that end up having a common origin, or again, a common destination. So they're carrying, similar information in that respect. These bundles, they could extend very long distances up and down the spinal cord. And so when they do that, we refer to them as tracks. Now, the ones that are going up, the ones that are going up or ascending are referred to as sensory tracks, because they're usually conducting, they conduct information or nerve impulses from the spinal cord up to the brain. So again, they're ascending, going upwards from spinal cord up to the brain. Then the tracks of the axons that carry impulses downwards, or away from the brain, down the spinal cord, are called the descending tracks or motor tracks. Again, sensory and motor tracks of the spinal cord, they're going to be continuous with sensory and motor tracks in the brain as well. right? Now, in the gray matter of the spinal cord and brain, we have clusters of neuronal cell bodies that form functional groups. And these functional groups, they're referred to as the nuclei. So the sensory nuclei, they get input from receptors. From what type of receptors? Again, these are sensory neurons. So again, they get information from receptors from the sensory neurons, and motor nuclei end up sending out output to the effector tissue by the motor neurons. Now, the gray matter on each side of the spinal cord ends up getting divided into regions, right? Now we're talking about the gray matters. So the gray matter, it ends up being divided into regions, and we call these regions the horns. The anterior, okay, again, or you can call it the ventral gray horn, it contains somatic motor nuclei. Somatic motor nuclei. And these somatic motor nuclei, they're clusters of cell bodies of somatic motor neurons, and they provide nerve impulses for skeletal muscle contraction. The posterior, or the dorsal gray horns, they contain the cell bodies, in addition to axons, of interneurons as well as axons of incoming sensory neurons. Now, between the anterior and the posterior gray horns, we have the lateral gray horns. And these lateral gray horns, we only find them in the thoracic, upper lumbar, and the sacral segments of the spinal cord. Okay, so again, they're not going to be there in the cervical portion or the lower lumbar. Now, the lateral horns, they contain cell bodies of autonomic motor nuclei, and these autonomic motor nuclei regulate the smooth muscle, cardiac muscle, and the activities of our glands. So when you look at this photograph here, again, what do we see? And so this is a cross section, it's a transverse plane of the spinal cord. All right. Obviously, this is gray matter, and this is going to be the white matter. So what do we have over here? So this part right over here, okay? This is the anterior white commissure, okay? Anterior white commissure. So then we have this part here and this part here. This would be the lateral white column, okay? So again, we have the anterior white commissure, the lateral white columns, and then we have this part and this part are called the anterior white columns, okay? Anterior white column. Between this anterior white columns, we have this little fissure here. So this is the anterior median fissure, okay? This is the front part, so it's anterior. This is the back part, it's posterior. So because this fissure is in the front, it's the anterior median fissure. Anterior median fissure, it divides this anterior white columns, and again, the spinal cord into right and left halves. As you go to the back side, okay, or the posterior aspect of the spinal cord, we have this posterior median sulcus. Okay, it's a deep groove, posterior median sulcus. What else can we see over here? We can move on to the gray, all right, so the gray horn. So when you look at this, what do we have? First of all, this is the central canal over here. This is that gray commissure, this part right over there. We have the posterior gray horns over here, posterior gray horn. This would be the anterior gray horn over here. So anterior and posterior gray horns. The gray commissure and the central canal. Okay. I think we covered just about everything. And then over here, you can see again, you have neurons. All right. So again, what are these? These are just ganglia, root. So this is the posterior root ganglia. So when you look at this posterior root ganglia, now let's look at this part. And this is kind of, you can see a sensory and a motor neuron coming outwards. So again, sensory information, again, sensation, feelings, they end up coming through this way. And here's that cell body of the sensory neuron. And then you have the axon of the sensory neuron. So again, it kind of goes out. And then on the other hand, over here, so again, the integration is taking place right over here. We have the cell body of the motor neuron. Okay, the cell body of the motor neuron is found over here. And then this is going to be the axon of this motor neuron that's going down this way over here. So as it's going down, again, you can see the nerve impulses. It ends up going to either a muscle or some type of skeletal muscle or tissue for that matter. So you'll see how this kind of works. So some information as it comes up this way, even before it reaches the brain, it just kind of goes around and comes back out. So this is essentially how a lot of these reflex arcs end up working. Information comes up and then it just goes right back out. If a threshold is strong enough, there may not be any need for brain involvement. Okay, moving along. What else is next? All right, spinal nerves. So as for the spinal nerves, again, spinal nerves, they connect the central nervous system to sensory receptors, muscles, and glands in all parts of our body. Now, we have 31 pairs of spinal nerves. With that said, again, the spinal cord, it looks as if it's segmented because of the 31 pairs of these spinal nerves that are coming off at regular intervals from the spinal cord through the intervertebral foramina. Now, each pair of spinal nerve is said to come off of a spinal segment. Now, within the spinal cord, there's no obvious segmentation. However, again, just for ease for learning, the naming of the spinal nerve ends up being based on the segment in where they're found. Now, there are 8 pairs. Okay, remember, a pair is what? Pair, you have 2. So there are 8 pairs of cervical nerves. There's 8 pairs of cervical nerves, right? So these nerves, they're from the first cervical nerve, second cervical nerve, third cervical nerve. So in other words, C1, 2, 3, 4, 5, 6, 7, and 8. Then there's 12 pairs of thoracic nerves. And again, those are T1 through T12. We end up having 5 pairs of lumbar nerves, L1 through L5. And there's also 5 pairs of sacral nerves, S1 through S5. And there's a single pair of coccygeal nerves. The first cervical pair, it comes off between the C1 and C2, between the atlas, actually not between the atlas and axis, between the atlas and the bone on top of it, which is the occipital bone, right? All the other spinal nerves, they come off from the vertebral column through the intervertebral foramina between the vertebrae that are located next to one another, the adjacent vertebrae that are there. All right. So when you look over here, what do we see? So this kind of, if you guys remember, muscle, we saw a segment in terms of tissue that's surrounding it. So Again, nerves and muscles, even though that they function differently, how they appear, their structure, it's rather similar in a lot of ways. So, in skeletal muscles, remember we said we had endomysium and we had the perimysium and the epimysium. So over here, it's somewhat similar. So what do we have over here? We have a myelin sheath that's around each one of them, around the axons. And then on top of the axons, we have the endoneuron, okay? Endoneuron. And again, so these individual axons, they're wrapped in myelin sheath. On top of the myelin sheath, then we have the endoneurium. Now, when you take bundles of these axons, they get wrapped around in a perineurium, okay? Perineurium, all right? So bundles of axons are referred to as fascicles of a fascicle. And then when you look at multiple fascicles, they are found, they're wrapped, okay? So again, this is the spinal nerve, and they're wrapped around in tissue that's called epineurium, okay? Epineurium. So again, it's relatively similar. What's next? Perineurium, epineurium, endoneurium. Okay. So yeah, this perineurium is holding many axons or many nerve fibers into bundles, and these bundles, again, they're called a fasciculi. Singular, fascicle would be plural. Right, and then again, when you look at all these multiple fasciculi that are bundled up, who covers multiple fasciculi would be the epineurium over here that's going along. I think that's, yeah, that's, and again, these are all just very strong connective tissue. They're collagenous sheets of tissue that are present. All right, now moving over here. So spinal nerves, they come from the spinal cord as, in series of spinal rootlets, okay? So spinal nerves, they come off from the spinal cord as a series of spinal rootlets. The two types of rootlets we have are the anterior, which is also referred to as the ventral rootlet, and then we have the posterior or the dorsal rootlet. From the anterolateral aspect of the cord, the anterior rootlet, it ends up emerging into 2 or 3 irregular rows. And so the anterior rootlet, it contains the axons of multipolar motor neurons that come from the cell bodies in the anterior region of the spinal cord's gray matter. These axons are going to end up transmitting action potentials to muscles and glands of our body. From the posterolateral sulcus of the spinal cord, we have another series of rootlets. And again, these are the posterior rootlets. And they contain the central processes of the sensory unipolar neurons. And these neurons, they're going to be transmitting action potentials from peripheral receptor organs to the central nervous system. So each series of the anterior rootlets, they converge to form the anterior roots, okay? Anterior roots, or the ventral root, you can call it also. So similarly, each series of the posterior rootlets, they converge, they come together to form the dorsal roots, or the posterior roots. So now each posterior root has a swelling, and we call that the posterior root ganglion. Okay, and again, what is that ganglion? Essentially, ganglia are the cell bodies of the nerve that's outside the spinal cord. So again, over here we're talking about the cell bodies of the sensory neurons. That's all that is. Relatively simple. So the anterior and posterior roots on each side of the spinal cord, they correspond to one developmental segment, or again, one level of the body. As the sensory posterior root and motor anterior root, they end up projecting laterally from the spinal cord. They come together to form a mixed nerve, and we call that the spinal nerve trunk. Okay, spinal nerve trunk. So again, when you see the term mixed nerve, essentially we're talking about when you hear the term mixed nerve, we're referring to a nerve that contains both motor and sensory axons. So the spinal nerve trunk runs for a short distance before it starts to branch into larger branches, and then a handful of smaller branches. All right. Now, each large spinal nerve branch is named a ramus, okay, or rami, would be plural. Okay, so each large spinal nerve branch, we call that a ramus, plural, rami. And so a ramus is going to end up following a specific course to different peripheral regions of the body. The two largest branches, we have the anterior ventral, okay, anterior or ventral ramus, and then of course the posterior or the dorsal ramus. And these are somatic branches that end up being delivered to the musculoskeletal wall of our body. The posterior dorsal ramus, it serves the deep muscles and skin of the posterior surface of the trunk. Okay, the posterior surface of our trunk, okay, is served by the posterior, or again, the dorsal ramus. The anterior, the ventral ramus, it serves the muscles and structures of the upper and lower limbs, in addition to muscle and skin of the lateral and anterior parts of the trunk. The meningeal branches, the meningeal branch, it'll re-enter the vertebral canal through the intervertebral foramen, and it supplies the vertebrae, the vertebral ligaments, blood vessels of the spinal cord, and the meninges. The communicating rami, or the rami communicantes, they're parts or components of the autonomic nervous system. And again, we'll talk about the autonomic nervous system in a couple of slides afterwards, or a couple of chapters afterwards. So over here, again, you can see this is some additional picture. Now remember what I told you before. Parts that are very important, they end up getting a lot of protection. And again, when you look at this protection, we have this one vertebrae over here, right? So this is the body of the vertebra. So all this bone is protecting the spinal cord. In addition to that, we said we have the meninges that are protecting it. And you can see meninges over here doing that. So again, here's your posterior root, or the posterior root ganglion is right over here. So this is the posterior dorsal root. Specifically, you can see the posterior root ganglion. And then over here, you have the anterior ventral root. Okay, so anterior ventral root, posterior dorsal root. And here's that, the posterior dorsal root ganglion. So again, this is the cell body of this sensory neuron. Here's a rami communicantes over here. You can see on either side. This is a posterior dorsal ramus. Okay, posterior dorsal ramus that you see over here. Okay, moving along. Moving along. What do we have? So moving along. Okay. Moving along. We have okay, plexus. let's look at the plexus now. So axons from the anterior rami of the spinal nerves, except for T2 through T12, they don't go directly to the body structures they supply. Instead, they form networks on both the left and the right side of the body by coming together with various number of axons from the anterior rami of the adjacent nerves. So these networks of axons we call the plexus. And the principal spinal nerve plexuses are the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. There's also a smaller coccygeal plexus. And again, the smaller coccygeal plexus what do we, hold on, we talk about that? All right, these are the, all right, so yeah, what come off from these, from the plexus are nerves that have the names that usually describe the regions they serve or the courses that they end up taking. Each of these nerves, in turn, they have several branches named for specific structures that they end up going to. Okay. All right. So dermatomes and cutaneous fields. All right. So this is fun. This is good. So the skin over our body ends up being supplied by somatic sensory neurons. And again, these somatic sensory neurons, they carry nerve impulses from the skin into the spinal cord and to eventually to the brainstem. So somatic motor neurons, they're going to be carrying impulses out of the spinal. I'm sorry, not somatic. Sorry. The somatic motor neurons, they will carry the impulses out of the spinal cord and to the skeletal muscles. So each spinal nerve, they contain the sensory neurons that serve specific segments of the body. So the trigeminal nerve, for example, trigeminal nerve, it serves most of the skin of your scalp as well as your face. So if you think back, here's the skin that provides sensory information to the spinal cord through a pair of spinal nerves. They're called dermatomes. Okay, so here's the skin that provides sensory information to your spinal cord and brain, your central nervous system, by a pair of spinal nerves we call dermatomes. So knowing which spinal cord segment supply each dermatome, it makes it possible to locate damaged parts of the spinal cord. Okay, so on the other hand, cutaneous fields, okay, these are regions of the skin that are supplied by a specific nerve that's coming from a plexus. So, for example, the median nerve from the brachial plexus, it has a distinct cutaneous field. Okay, brachial plexus, right? The median nerve from the brachial plexus has a distinct cutaneous field. Now, this cutaneous field, it overlaps with a handful of dermatomes because the median nerve, it contains neurons from multiple spinal nerve levels. All right. All right, that's good. So it kind of helps with anesthesia as well. Information about the innervation patterns of the spinal nerves can, again, you can use this therapeutically. So cutting posterior roots or infusing local anesthesia, you can block pain signals temporarily or again, even permanently. Because dermatomes overlap, deliberate production of a region of complete anesthesia, it may be possible. Okay, so again, you end up getting you can end up getting nerve blocks, for example, take place by the use of anesthetic drugs. So again, you can see over here. So this part of your arm, it ends up going into again the sixth cutaneous field that's going through over there. Okay, so C6. This part ends up going to at the T2 level. This part at the T1 level. And when you look at the fingers, again, different parts of it, there's different cutaneous fields that go. So C6, C7, C8. Reflexes and reflex arcs. All right. Reflex. And actually, we'll stop over there. But before we stop over there, what we're going to do here is do roll call. So we'll do an attendance now. And all right. All right. So attendance, make sure you listen for your names. Then we'll take a break afterwards. I'm going to call your name once. If you don't respond, you're marked absent. So don't come back. Do not message me and tell me I was here, I couldn't hear you, whatever. So those of you who have your radios on, make sure you shut them off. And turn your microphone off until I call your name. Don't really turn them on. And if your camera's off, I might mark you absent also. I told you guys from the beginning. So if those of you want to go and run and grab your hijab, go ahead and do that. Student list, attendance. So listen up for your names, please. Somebody's making a lot of noise with the microphone, and I just asked you to keep your microphone off until I call your name. All right, Abdul Rahman El Abdidi. Abdul Rahman El Abdidi, absent. Abdullah Yaqubi, absent. Afaf Bazar Bashi, absent. Agatha Chioma. Elena Shirin Arslan. Elena Arslan. Elena is absent. Aseto Tolo. Aya Muhammad Hassan.
Yes, sir.
Aya Muhammad Hassan.
Yes, sir. I'm here.
Okay. You know, you all have your microphones open. I told you, shut them off until I call your name. I'm going to come and check to see who has their microphone open and hasn't shut it off. And I'm going to end up. Shut off your microphone. You still have it on. When your name is called, then you shut it off. Okay. Aya Muhammad Abdul Rahman.
Yes, sir. I'm here.
You're here. Okay. Aya Mustafa Malik. She's not here. Aisha Shawal. Baitul Mazlum. Baitul's absent again. Beline Sude Öztürk.
Doctor, sorry, but you skipped my name.
Yeah, me too.
Beyza Erdogan.
Me too.
Beyza is absent.
I am here.
Who's here? Beyza?
There's Erdogan.
There's whose name did you? Who said I skipped their name?
Aya Kandakji skipped my name, sir.
What's your name?
Aya Kandakji.
Me too, Ayat Al-Bayouk.
Me too, Amira Imad.
Yeah, okay. If I didn't call your name, that means you're not on the list. So I don't know. Don't say me too, me too.
Me too.
Okay, listen for your name. I'm not skipping anybody's name. If I didn't call your name, you're not on the list. I'm going over different classes together, okay? So just hear it for your name. I'm going over, I have 3 different sections: nutrition, nursing, and child development. So your name may not be here. I may not be in your class. Beyza Atli. Beyza Atli. Burju Duan. By the way, those people that are coming in late, you're absent. I'm not going to take you in already. I already saved the attendance list. Burju Duan. Burju. Burju is absent. Burju Mulbe.
Yes, I'm here, teacher.
Okay, very good. Burju Shoilar.
Yes, I'm here.
Right.
I'm here.
Burhan Altun.
Yes, I am here, teacher. Yes, I am here.
Bushra Lutfi.
I'm here.
Bushra is here. Bushra Aktürk.
I am here, teacher.
Okay. Is
Bushra
Lutfi here?
I'm
Bushra
I'm
Lutfi.
here.
I'm
I'm
here.
here.
Okay. Jala.
I am here, teacher.
Dilan. Hardalolu.
I'm here.
Okay. Eda. Eda Metin.
I am here.
Emre. Yabashir. Emre. Absent. Engin Jan. Ezra Rahal.
I am here, teacher.
Ezra, you're here?
Yeah, I'm here.
Ezra is here. Okay. Rahal, or not Rahal, I'm sorry. Ezgi Tiryaki.
I'm here.
Come on. Then there is Faizanur Yaman. Faizanur is absent. Fulin Varolu. Fulin. Gamzenur Kurban.
I'm here.
Kubre. Hamdiye Kubra Ertürk. Hande Waran.
I'm here, teacher.
Hande is here. Hande Nur Turan. Hande Nur. Haneen Ramdanolu. Haneen Abbazid.
I'm here.
How about Haneen Ramdanolu? Absent. Haneen Al Muhammad. Absent. Hibbatullah Mahdi Al Sadi. Hilal.
Doctor, I'm Hanin Al Muhammad. I'm here.
Oh, I called you. You didn't respond.
There's a problem in the mic. Sorry.
I don't. Hilal. Hilal's not here. Hulda. Alam.
Present.
Okay. Ishan Akchay.
I am here, teacher.
Ishan is here. Ilaida Biro.
I'm here.
Ilhan Usundag. Iram Atash.
I'm here.
Iram Nad Olcher.
I'm here.
Jana Abdul Karim Fauzi. Jana Abdul Karim. Jovita Jan. Jovita Jan William. She's going to be kicked out of the class next. If anybody knows her, she's going to be dropped from the class if she has one more absence. You can tell her that. Kauthar Muhammad. Kauthar Muhammad. Kauthar is absent.
I am here.
Okay, stop. Shut your microphone off. Whoever's rattling their things, shut off your microphone, please. You still have your microphone on. Who is that person? I'm going to get very annoyed when I find out who you are. I asked you multiple times, shut up. Mercy, shut off your microphone. Mercy, again. Mercy, I'm marking you absent. And I'm going to kick you out of the class now. You can't follow directions, Mercy. Okay, moving. Where's the next student? Kauthar Muhammad. Kauthar.
I am here, doctor.
All right. Al-Bashir Amir Dawood Al-Ani. Maram. Miriam. Maram is here. Melissa Elif Tak Tak.
I'm here.
Marve Kiratli.
I'm here.
Okay. Mina Takiroli.
I am here.
Okay. Muno Omar Noor.
I'm here, teacher.
Okay. Nemo Rashid. Nemo.
I'm here, teacher.
Okay. Nura Al Rashid Hassan.
Yes, I'm here.
All right. Noor Akila.
Yes, I am here.
Nuran Nasser.
Sorry, teacher, you skipped my name.
Nuran Nasir. Nuran.
Teacher, you skipped my name.
No, I didn't skip your name. Nuran
No.
Nasir.
It's before Noura Al-Rashid.
Nuran Nasir.
Nuran Nasir, you're here. Okay. Nuran Al Ghali.
Yes, sir, I'm here.
Very good. Odesi Owen. Odesi
Teacher,
Owen.
Yeah, just.
Yeah, are you here? No, you're not. You're absent now. Omama Sayed.
teacher, my name is Raid. Before
Yeah.
Noura.
I'm here, sir. Umama Sayed.
Okay, Umama is here. Rabia Aras. Rabia? Rabia is absent. Rabia Noor? Not here. Raed Mansoor.
Yes, I am here.
Ragid Hakimi. Hakami. Ragad Hakami. Rana's here. Reem.
I'm here.
Reem's here. Rehan Ozgun. Razan Ghalib.
Yes, I am here.
Oh my God, okay, a new one. Sadra Al Muntaha Abdul Qadir. Sadra, absent. Safiya Noor,
I'm here.
okay. Sahara Abdul Salam. Sahara Abdul Salam, absent. Saliha Kilich.
I am here, teacher.
Sarah, very good. Sarah Sheikh Salim.
Salia is here.
Thalia, I got you. Sarah Sheikh Salim.
I'm here.
Sarah's here. Sarah Abdul Atif Ahmed.
Yes, doctor, I'm here.
Okay. Sarah Aliyah. Sarah Aliyah, absent again. Ida Noor Karakbak.
I'm here.
Ida Noor is here. Okay. Silin Okunak. Silin.
I'm here.
Right. Sene Noor Cert. Not here. Next is Songul.
I'm here.
Very good. Sumaya Karaman. Sumaya is absent. Shaima Sultan.
I'm here.
Shaima is here. Tariq Anwar Al Hadi. Tariq is absent. And then the Zakia Hassan. Absent. And Zainab.
Present.
Zainab is present. Very good. Okay. All right. Done.
Teacher, you don't say me.
Okay.
Teacher.
Semanur Kula, I am
Teacher.
All right. So I just
Me
did
too,
the
teacher.
attendance for the. This is for the nutrition class.
Teacher.
Yes, teacher, my name also.
You don't say my name.
If I didn't say your name, you're not in this class because this is for nutrition. I didn't do nursing yet. If you would have listened instead of listening to the radio or talking to your friends, then you would not be asking this question.
Teacher,
In the
I'm
child
in
development.
because you didn't
So you
say
only
my
call
name.
nutrition
All right,
students,
we'll
right?
take a break.
Teacher, you didn't say my name. I'm in nutrition.
Teacher, I
Then
didn't.
you're not on the list. Then I don't know. You're not on the list. If your name is, if I didn't call your name, then your name is not on the list. All right, so let's continue with the lecture. All right, so let's see. Here we go. So we went over, let's see, the last slide we went over was, all right, so we stopped over, we had reflex arcs. Let me actually allow this, where are we? Go. Okay. Actually, you know what I'm going to do before we get started? Before we get started, let's go over here. Just a minute, and then we have, where are we at? Okay. Week 11. Okay. All right, listen up for your names now. We have Abdullah Ibrahim, Abdullah Jalil Ibrahim, absent. Abdul Razak Adamu, Abdullahi.
Present, sir.
Okay, very good. Aduranki Esther Ayewole. Aduranki.
I'm here. Present.
Okay, Adewesa Adesiwa Tamil, I can't say. Okay. Adna Awali.
I'm here, sir.
Ahmad Al-Qasar. Ahmad Farsid.
Yes, sir, I'm here.
Ahmad Syed. Ahmad Sami Saleh Qaid.
I'm here. Yes, sir.
Alena.
Yes, sir, I'm here.
Very good. Alena Hassar. Alena Hassar. Absent. Amal Ibrahim Zane Karia.
I'm here, teacher.
Very good. Amir. Amir Fawzi Al-Isa.
Yes, doctor, I am here.
Okay. And then there's Amina Omar Wahib. Amina.
Yes, teacher, I am here.
Anisa Awale.
Yes, sir, I'm here.
Arman Erdogan.
I'm here, sir.
Okay. Sia Kadar Noor. Sia Kadar Noor. Aya Kandakji.
Present.
Ayat.
I
Yes.
can be present.
Ayat.
Ayat Albayuk, yes, I'm here.
Very good. Aisan. Aishan. Muhammad Ashki. Azad Furkan. Bara Najib Abed. Bara.
Yes. Yes, I am here.
Very good. Barakat Omolara, Barakat, Baran, Jaylan, Barfu Azgi,
I've written message to him before.
Barfu Azgi.
Barakat is here.
Barakat, you're absent already. Too late. Barfu Azgi.
My microphone
I
is
am here,
open.
teacher.
That's why.
Barfu,
I am here.
Barfu Azgi.
I am
Very good.
here today.
Barfu is here. Excellent. Beza Duran. Beza. Beza Nur Uimaz.
I'm here.
Blessing.
Sir, present.
Hold on. There's two blessings. Which blessing are you?
Bless Napalabe.
Okay, very good. How about blessing Shitu?
I'm here, sir.
Listening to your music. I see.
No.
Bukola Adiyemi. Okay. Bushra.
I'm here.
Bushra's here.
Musa is here.
Chimdi Adi.
I'm here.
Chimdi Adi is here. Clear.
I'm here.
Okay. Prince, I saw you here. Christina Olabi.
So did you say Prince?
Yes, I know you're here. Christina Ayomidi. Dilara Gul. Dilara Gul.
Teacher, I am here.
Dilara.
Teacher, I am here.
I don't know who you are, but I'm not going to go back to your name now. You should have.
I am Dilara Gür.
Good, huh? Dilara Mert. Dilara Mert. Duygu Kolchu. All right. Ikene Martins.
Yeah, I am here.
Very good. Elias Musumba. Elif AJ Chitrik. Elif AJ. No. Emmanuel Okafor.
I'm here, sir.
Esther Ole Inca.
I'm here, sir.
Okay. Fadumo Usman Abde. Fadumo is absent. Fatima.
I'm Dilara Mert. I'm here.
Fatima Komoni.
Yes, I'm here.
Very good. Fatima Muhammad. Fatima Muhammad is absent. Fatih Kazan. Fatih Bey is one. Fatih Ochakchi. Both Fatihs are not here. Fuad Muhammad Harir. Fuad. Furkan Kilic.
I am here.
Furkan is here. Very good. How about Ganiyat Hakim? Ganiyat Oyindamola.
I am here, sir.
Gaye Yildirim. Gaye. Absent.
I am here, sir. Daniel Akim.
Ganiyat, I got you. Glory Ane Eli.
Yes, teacher. I am present.
Very good. Hafifa Bakuban. Absent.
I'm here, sir. Haifa Bakoban.
Haifa. Hayadia Ishak.
Yes, I'm here.
Okay. Hussein Kanso. Hussein. Ikran Abde. Ikran.
Yes, sir. I'm here.
Ibrahim Turut. Ibrahim is absent. Irem Birlik.
I'm here, sir.
Good. Jana
Yes, sir. I'm here.
Very good, Jana. Hesuhoba testimony. Kadiatu Muhammad. Kadiatu is absent. How about Kauthar Imad Hiwadi? Kauthar Imad is absent. Khadra Abdi Adil.
Yes, teacher. I'm here.
Okay. Khalud Ahmed. Khalud.
Yes, I'm here.
Very good, Khulud. Made Malike Gune.
I'm here, teacher.
Okay, how about Malak? Malak?
Yes, sir. I'm here.
Very good. Mamon Albata?
Yes, teacher, I am here.
Okay. Mercy Alajo? Mercy. Mert Yildirim?
Present, sir.
Mert is here. Mert is absent. Muhammad Osman.
Yes, sir. Now,
Muhammad Osman, absent. Muhammad Aminel. Muhammad Aminel. Muhammad Aminel, absent.
I am here. Mohammed Emine. I am here.
Okay. Muhammad Ayub Bikman.
I'm here, sir.
Okay. Murad Basharan. Murad. Nedie Niding. Nedie Na Niding.
I'm here.
You're here. Ninika Precious. Ninika Precious Honora. Nofita Olu Sigun. Nura Ali Muhammad Jama.
Here, sir.
Okan Kayin.
Yes, sir. I'm here.
Okay. Ajayi. Joshua Ajayi.
Present.
Present. Bolu Watufe Adiyemi.
Present.
Okay. Onur Karadoan.
I'm here.
Onur. Very good. Omer Farooq Sarkoz. Omer Farooq Sarkoz. Absent. Precious Oreyabure.
Yes, I'm here, sir.
Princess Shira.
I'm present, sir.
Shira. Present.
I'm
I'm
present.
present, sir. Yes, sir.
All right. My dream, Rumesa. Rumesa.
I am
Rumesa
here.
is here. Okay. Rumesa is
Yes,
here.
I am here.
Ruth Oleinka. Ruth is absent.
present, sir.
Samira.
Here.
Samira is here.
Yes.
Ruth, check the microphone off. Thank you.
Samira
is here. Samira is here. Samira, are you absent?
No, I'm present.
Okay. You're present. Very good. I'm present also. Samuel.
Yeah.
Samuel. Unisa.
Here. I'm here.
Very good. Seda. Seda Birinji.
I am here.
Seda is here. Silin Sabas.
I'm here, teacher. Silin Sabas.
Silin Sabas. Günaydın.
Günaydın.
Semanur Kula. Semanur.
I am here.
Sezen Akti. Sezen. One. Absent. Suad. Samantha.
Sir, Sezan has a microphone problem.
Oh,
She
too
told
bad.
me about it.
Suad is here.
I'm here, Zad Samantha is here.
Okay, okay. Sude. Sude. Sude Balabanolu is absent. Who's next? Next is Sundus. Sundus is not here.
She's here, sir.
No, she's not speaking, so she's absent.
Her camera.
Chulwani. Chulwani. O.P. Gabi. Tuba Manolu. Tuba's gone. Umut Gungur.
I am here, teacher.
Umut is Osman Sani. Usman. Absent.
I'm here.
Usman.
I'm here.
Usman, what's your ID number?
2005
Okay.
12281.
Okay. All right, very good. Vegdan Al-Khalil.
I'm here. I'm here.
Vegdan,
Yes.
you're here? Okay.
Yes.
Yamur. Yamur Gilio. Tamam. Yevat Mababazi. Absent. Zilal Salah. Zilal is absent. And Zena.
Yes,
Zena,
sir. Yes,
Zena's
sir.
here?
Yeah,
All
I'm
right.
here.
Zena from Ukraine is here. Good. All righty. So here we go. Okay. That's that. All right. Now the attendance is out of the way. We can continue with the lecture. All right. Here we go. All right. So moving along, what we have is.
Please, doctor, you don't.
All right.
My name.
I probably did. You didn't hear it, so you got absent. We'll just leave it at that. I need to continue the lecture. I can't deal with the attendance issue now. Moving along. All right. Shut off your microphones, please. You need to. Okay. All righty. So let's continue now. All right. So where are we on reflexes? Okay. So all right. So the spinal cord it ends up ensuring promoting homeostasis by serving as the center for integration for certain reflexes. Some of them, not all of them. So is that exactly what is a reflex? So a reflex is it's a rapid response. It's an involuntary response, and it's an unplanned sequences of actions that take place in response to a specific stimulus. So again, a reflex, we can define it as being involuntary, fast, and unplanned sequences of actions that occur in response to a particular stimulus. So some reflexes you're born with, such as when, for example, when you pull your hands away from something that's very hot. So even before you're about to touch a hot pot or a stove or an iron for that matter, you end up moving it away before that signal reaches your brain. Other reflexes, you end up learning them, okay? Or in other words, these are acquired reflexes. So some of these reflexes, again, acquired reflexes, think about them. Now, a lot of you may not have developed these, but driving a car, okay, you end up building certain reflexes, in other words, you see somebody that's in front of you, immediately you take your foot off the gas and you slam on the brakes with that. So this is an example of that. Now, when integration takes place in the spinal cord gray matter, the reflex, we say it's a spinal reflex. And an example of a spinal reflex is this knee jerk that we end up having, or the patellar reflex, as it's also called. So if integration occurs in the brainstem rather than the spinal cord, then we call that a cranial reflex. Okay, so if the integration occurs in the brainstem instead of the spinal cord, we call that a cranial reflex. And an example of that is again, your eyes tracking, the words that you're reading right now. Okay, so that's an example of cranial reflex. Now, somatic reflexes involve contractions of skeletal muscles. Okay, and autonomic or visceral reflexes, generally speaking, we can't feel them. Okay, so they're not perceived. They involve responses from smooth muscle or cardiac muscle, or again, even glands. So like, your body functions such as your heart rate, your digestion, urination, defecation, they're all controlled by the autonomic nervous system through the autonomic reflexes. So moving on to a reflex arc. Now, a reflex arc, very simplistically, it consists of the following. There's a sensory receptor, there's a sensory neuron, all right? There's an integrating center, and there's a motor neuron, and there's an effector, okay? Sensory receptor detects a change. That neuron, that nerve, it carries that information or that change to the integrating center, which from that point will then send it with that reflex arc to the motor neuron, and the motor neuron will then end up going to the effector. Okay? So when you look at this photograph over here, what we have is a schematic, and in this schematic, what we see is, look, we have sensory receptors over here, okay? And these sensory receptors, they detect some change. And again, they're showing this patellar reflex at this point. So when it detects this stimulus, it sends it up the sensory neuron. Okay, this is your sensory neuron. And from that point, the signal has two paths to kind of go with, okay? There's a couple of different paths for it to go with. Now, one path, it's going to go to the brain. And again, for like small things, normal things, when the stimulus is not very hard, it will end up going to the brain. And then the brain feels it, decides what to do with it. However, if the stimulus is strong enough, okay, if it's to trigger these sensory receptors, if the stimulus is strong, then what ends up happening is this. The signal, not only does it go to the brain, but even before this information reaches the brain, it goes around over here. Okay, it's going to arc over here, and so this part here, this is that integration center over here. That information will then go to the motor end, this motor neuron, and then the motor neuron then goes to the effector, cause these muscles to contract. When these muscles contract, you pull out. You kick your leg outwards. Okay, that's it. This is essentially a reflex arc. Okay, so what do we have? We have a sensory receptor, we've got the sensory neuron, we've got the integration that takes place over here, and then there's the motor neuron, and the motor neuron connects to an effector, okay, which in this case is the muscle. Okay, that's it for this first chapter in chapter 17. Moving along to chapter 18, now we're going over the brain and the brain and cranial nerves. So when you look at brain and cranial nerves, let me do something before stop recording.